Hello, and welcome to this breakout session entitled Creative Solutions to Protect the Needs of the Veteran Farmer. My name is Linda Emanuel. I am a registered nurse. I work in a community health nurse role with AgriSafe Network. And joining me today as a co-presenter is Alyssa Damke. She holds a bachelor's of microbiology. She is a master's of public health candidate with a specific concentration in environmental, ag, and occupational health. We are excited to be here and thankful the MRASH committee has worked through this culture of a pandemic to be able to allow us to continue to benefit and learn from each other. Our learning objective today will be to identify 3 best practices to adequately serve the specific healthcare needs of the veteran farmer. In the United States, a different set of health disparities exist among the rural populations as compared to our urban counterparts, and this we know. Rural are at greater risk of dying from cancer, heart disease, unintentional injury, and stroke. And these disparities can be attributed to a lack of preventative health resources, as well as that distance that it takes for those veteran farmers to receive emergency care and preventative care. Put an agricultural producer and their workers, as well as a veteran farmer together, and those risks are almost doubled. The infrastructure to care for these veteran farmers often does not include an occupational approach which considers the many facets of working ag, as well as a history of exposures while in active duty. First of all, we wish to thank our veterans with a very sincere thank you. Your sacrifice to serve our country while potentially sustaining physical and emotional injuries, as well as being away from your families, is deserving of our gratitude. And this month is traditionally held as Veterans Day. We celebrate Veterans Day during the month of November. And this year's theme is Vision, Veterans in Focus. While we know hindsight provides lessons learned, we realize the importance to maintain a commitment to the vision for our future veterans. And so this month we take a reflective moment to say thank you. The Veteran Farmer Health Risk Assessment is a tool that AgriSafe has taken. It's a creative approach to addressing the veteran farmer's total farmer health needs. It addresses the physiological, psychological, spiritual, and sociological health disparities of this unique population. This online confidential e-tool will provide a means to screen, assess, identify, and provide strategies for individual risk-appropriate preventative steps. The veteran farmer can receive appropriate care recommendations based on his or her personalized farm exposure, symptoms, and prior histories. And then links will be provided to evidence-based resources that will help the veteran farmer in preventative care. It's a type of algorithm. This tool then will provide talking points that can be easily shared with the veteran farmer and his or her physician. We know that in the 2017 farm census, there are 3.4 million ag producers. Of that 3.4 million, over 370,000 producers had served or were serving in 2017. The average age of the non-veteran producer is 57.5 years of age. The average age of the producer who has military service is 67.9 years of age, almost a decade older. These are experienced farmers, with 81% of them having farmed 11 years or more. And for more than half of them, farming is their primary occupation. And that is the reason why AgriSafe has taken this specific focus on the veteran farmer. And when you look at county levels, the share of the producers with military service is highest in the southeastern part of the United States. So important that we look at military service and the era served. As of the 2017 farm census, majority of male veterans had served in the Vietnam War. The majority of the female veterans had served post 9/11. When we think about those males that served in the Vietnam War, a host of diseases resulting to Agent Orange pop up, and a lot of those are cancers, as well as peripheral neuropathy and amyloidosis. Other diagnoses related to this population are hepatitis C and noise-induced hearing loss. For females in particular, we think about the next gen or the next generation, and those are those gals that are born after 1980. They will have their own unique set of health problems and many times, unfortunately, are overlooked. We know that the next generation prefers to go back to rural areas, and that next generation wartime served includes Operation Enduring Freedom, Operation Iraqi Freedom, and Operation New Dawn. The majority of this generation worked Army, and 3 top disparity diagnoses have been identified within this population, and those include musculoskeletal, mental disorders, and symptoms and signs ill-defined as related to respiratory symptoms and symptoms involving head and neck. So AgriSafe did a think tank. We asked veteran farmer attendees, as well as those who have an interest in the veteran farmer, their top health condition as related to that population. And what stood out was PTSD and back injuries, as well as a host of other mental health disorders. So AgriSafe is focusing on 3 areas to get us started with this veteran farmer health risk assessment tool. The first one is musculoskeletal injuries, or MSDs. MSDs are the most common cause of chronic pain and long-term physical disability. 81.5% of those veterans suffer from chronic pain. And of that chronic pain category, low back pain is the most common. The prevalence of low back pain among veteran farmer patients, veteran health administration type patients, those patients that are seen in the VHA, that is, that prevalence is increasing more rapidly than depression or diabetes. When we think about low back pain for our soldiers, it may be due to carrying those backpacks over rough terrain when they're working downrange, down there in active fighting. And the cause of that pain is a little bit different for men and women. For many times for men, it may be due to parachute jumps, explosions, falls, or flying shrapnel. For women, it can be associated with their lifting, long marches, contusions, and falls. And many times that back pain occurs in conjunction with PTSD and depression. For farmers, we know that they have their own inherent set of injuries, many times related to their work. There's slips, trips, and falls, the heavy lifting of feed bags and maybe newborn calves, heavy labor that is required for them to get their work done. For veteran farmers, then, they're doubly at risk for musculoskeletal disorders. Veteran farmers, they are noted to have difficulty in learning when to put the work away. That transitioning to civilian life has its difficulties. When they're active military, their tasks are clearly defined and expectations are for perfectionism, and they have a strong work ethic. They find it difficult to find that need to find balance and achieve that restorative sleep. And this approach can take a physical toll on their bodies. Also within that musculoskeletal injury list is arthritis. In particular, osteoarthritis. It's the condition that represents the largest portion of all classes of arthritis. That osteoarthritis is due to trauma and overuse of injuries. And just a little bit of A and P, remember, osteoarthritis occurs when the protective cartilage that cushions the ends of your bone wears down with use and time. Most commonly, it affects your knee and hip, hence the hip and knee pain. And we also have to take in consideration those veterans that have come back with a loss of limbs. Second focal area is veteran health access. The VHA provides health care services and benefits to individuals who served in active military, naval, or air services and did not receive a dishonorable discharge. And we have found that those healthcare service benefit packages differ from veteran to veteran. It is based on a priority group rating, and that priority group rating is subject to change annually and is affected by the VA budget. The complexity of the VA health budget benefit, that is package, changes from year to year and may contribute to increasing some of the health disparities in rural veterans. The healthcare infrastructure in rural areas may not take into consideration the veteran's occupation and may misdiagnose or mistreat symptoms as related to agriculture and active duty exposures. Barriers exist then for those individuals who live rural and are less likely to access the VA because of that distance. Age plays a role. Remember, I said that the veteran farmer is almost 68 years of age, and they may not feel comfortable in driving into metropolitan areas, let alone the time commitment for those VA appointments. And will they have family available to transport them? When we looked into the VA, the Veterans Health website, we found the My Health eVet. It is a nice resource that offers tips and tools to help partner with the Veterans Healthcare team so together they can work to manage their health. Also on that website was eBenefit, is a web portal that provides service members, veterans, and their families, and authorized caregivers with a single sign-on. They have essential access point to clinical benefits. It's important to note that these veterans need to apply for these services before a medical illness or injury occurs for efficiency of care. So within that think tank that we did, we talked about mental health, and we asked the participants what words come to mind when thinking about mental health, and depression and anxiety stood out. We think about mental health disparities. We know that PTSD is definitely a focal area for us, and the average, on the national average, PTSD exists among 7% of our population as a whole. When we think about military, those folks that served in Vietnam have a higher prevalence of PTSD, followed by those veterans who served in Operation Iraqi Freedom, Enduring Freedom, and New Dawn. Veterans with a history of traumatic brain injury are more likely to take their life by suicide, unfortunately. We look at depression. Soldiers have a difficulty with sleep habits, finding balance, rest, and knowing when and how to shut work down, which definitely contributes to their depression. And when we think about farmers, they're right there. They are susceptible to work-related stress, as well as having trouble knowing when and how to shut down their work. The National Ag Safety Database shows the forms of depression for farmers include major depression with bipolar disorders, those combined with anxiety disorder and alcohol drug misuse, spousal child parent abuse, personality disorders, and psychotic disorders. The VHA also noted that rural patients tend to underutilize healthcare services. There's difficulty in securing those mental health appointments if they're not considered urgent or immediately suicidal. And so their services are not very timely. Factor in the distance and the time away for care. We also know that mental health professionals are noted to have a shortage of those professionals that work rural. And then think about healthcare coverage. Will their healthcare, those private payers, will they cover mental health care? Along with, in that disparity grouping is stigma. A social and cultural stigma prominently exists amongst veterans and farmers alike. They have that physical, rugged, pull up the bootstraps, let's get to work. And so that may get into the way of them seeking care, that mental self-reliance. We also know that those rural communities are close-knit. People tend to know everybody else's business, and there's a fear of remaining anonymous as related to mental health, and that could impede their ability to receive care. We do know that telehealth is a solution to reduce the disparity. Unfortunately, internet connectivity and insurance coverage and provider ability are substantial challenges. So, what is AgriSafe going to do to help these disparities? We have incorporated the adept skills of Alyssa Damke, who I introduced, and we are very thankful for her determination and focus on this project, and she will go into her qualitative interviews with healthcare professionals.
All right, hello. We're just going to dive right into it. Rural healthcare providers were identified and asked to participate in a brief 15-minute Zoom interview consisting of 8 comprehensive questions. Interview questions were designed to assess the major healthcare concerns affecting veteran agricultural workers, to gain a better understanding of the gaps in healthcare professional competency when caring for veteran ag workers, and to identify best practices to serve specific healthcare needs of this unique population. A total of 10 rural healthcare providers were interviewed across 3 different Midwestern states, these states being Nebraska, Iowa, and Kansas. Interviewees included registered nurses, nurse practitioners, physician assistants, medical doctors, and doctor of osteopathic medicine. Interviews were recorded and with provider permission, and these recordings were analyzed via the qualitative analysis method of thematic analysis. This included transcribing recorded interviews, coding the transcripts, and assigning major themes. Providers were first asked what the top health concerns affecting veteran ag workers in their rural communities were. The major themes identified were lack of access, chronic conditions, and mental health conditions. Chronic conditions such as hypertension, diabetes, cancers, COPD, and dementia were all common responses. One provider shared that the patients who served in Vietnam had unusual cancer diagnoses, to which the provider attributed to Agent Orange exposures. The infographic depicted on the right from the National Council on Aging is a great visual that highlights many of these chronic conditions. Mental health conditions such as depression, anxiety, sleep disturbances, and PTSD were also common responses. Lack of mental health services, as well as the cultural stigma surrounding mental health conditions, were reasons speculated by providers concerning the frequency of these type of illnesses in their communities. Living in such a close-knit community makes it difficult to maintain a certain level of privacy, and this may act as a deterrent to one seeking mental health services. Discussions surrounding both the chronic and mental health conditions were oftentimes attributed to lack of healthcare access, both for general care and mental health care. One provider shared that while working in a rural clinic in western Nebraska, some patients needed to travel 90 miles just to be seen for a sinus infection. Question number 2 asked providers to differentiate health concerns among the older and younger veterans. For the younger cohort, the major themes identified were mental health conditions, more open to discuss, accident-prone, and musculoskeletal conditions. Several providers shared that mental health conditions might appear to be more prevalent in the younger generations because they are more likely to discuss these issues and be aware of the medications and treatments available compared to the older generations. Younger also experience more acute type musculoskeletal injuries by taking more risks. Providers deemed this as being more accident prone. For the older cohort, the major themes identified were chronic illness, substance abuse, cancer, and chronic pain. Although mental health was not one of the major themes for the older veterans, providers shared that they felt that older veterans might have dealt with these issues by self-medicating. Many providers discussed alcoholism or other substance abuse as an issue seen more in the older generations. One powerful statement a provider shared was, and I quote, "I think sometimes it's more acceptable to probably be an alcoholic than it is to say you're depressed or anxious," end quote. Chronic illness, including cancers and other respiratory conditions, were attributed to pesticide use and working on a tractor without a closed cab, as well as military exposure such as Agent Orange in Vietnam. COPD and diabetes were two chronic illnesses discussed frequently, and providers attributed this to many of the older veterans being smokers. The physical aspect of both serving in combat and tending to agricultural work causes chronic pain in many of these aging veteran ag workers. Question 3 asked providers to differentiate health concerns between male and female veterans. The major theme extracted from the interviews concerning male veterans was that of preventable illness. According to several providers, females just have a higher health compliance than that of their male counterpart. Females seem to be more willing to be a part of their care and more accepting of preventative healthcare services, where males might miss preventative checkups or otherwise. One provider said, and I quote, "It just comes back again to access," end quote. Having to travel long distances to seek care while also managing an ag operation becomes a major barrier for these populations. Other major themes identified for the female cohort were home and work stresses, musculoskeletal injuries, and fewer female patients. A few providers shared that they just don't see many female veterans who are also ag workers. Others mentioned females are more prone to musculoskeletal injuries compared to males because females are performing the same type of ag work tasks as the males, but due to the ergonomic differences between the two genders, females tend to be at a higher risk for injuries. Providers also mentioned that balancing outside the farm work, family, home, and farm work contributes to high stress levels in the female cohort. Question 4 asked providers to describe any combat-related injuries or illnesses that veteran ag workers suffer from that may become aggravated by performing ag work tasks. The major themes identified were physical injuries, mental health conditions, and chronic illness. Physical injuries such as back injuries and other musculoskeletal strains were common responses. Regarding mental health, issues such as PTSD, stress, anxiety, and depression were all mentioned. In addition to the trauma and stress experienced in combat, these military folks are coming home to either start or continue their farm or ranch operation in a shaky economy. And to top it off, they have little control over profits as yields are often dependent upon current economic and climatic factors. To quote another provider's response to this question, and I quote, "You can't control the floods last year, you can't control the drought this year, you can't control the economy that shut down for COVID," end quote. These work and financial stressors compound and can exacerbate mental health conditions in these veterans. Chronic illnesses such as hearing issues, cancer, COPD, and other respiratory issues were all common responses provided. Chronic respiratory issues attributed to chemical exposure in Vietnam, green dust and/or burn pit smoke exposure in Iraq and Afghanistan were mentioned in the majority of provider responses. Question 5 asks providers if there is a demand for a particular healthcare service in their community in which their facility might be lacking. The major themes identified were improve healthcare access, mental health services and facilities, specialty health services and facilities, and non-healthcare meeting space for veterans and education outreach events. To be expected, healthcare access and lack of mental health services has been a major theme throughout this entire project. One provider stated, and I quote, "The area that we serve is so very rural, the resources are very lacking, and it's not uncommon for people to have to travel an hour and a half to 2 hours one way to receive any type of service," end quote. Regarding treating patients with mental health concerns, another provider stated, and I quote, "The most problematic thing for us is to get mental health providers. I am forced to do things in my practice that I don't necessarily always feel comfortable with," end quote. Specialty health services and facilities such as cardiac facilities, surgical services, obstetrics and gynecology services, orthopedic facilities, and gastrointestinal facilities were all mentioned in provider responses. A few providers thought that a safe, non-healthcare related meeting space for veterans and for education and outreach events would be beneficial. Providers shared that common meeting space in their communities were oftentimes the local bar, so having a separate meeting space to host events and promote a healthy home would be more ideal. Question 6 asked providers what programs and/or resources are in place in their community to promote veteran ag worker health and safety. The major themes identified were VA services and facilities and community support services. The community support services that providers mentioned in their responses included local voluntary EMS, extension education agents, affiliations with state universities, annual health fairs, public health district, and a monthly health newsletter. Regarding VA services and facilities, some communities had their own VA clinic and VA assisted homes, and some communities had volunteers that would drive veterans to and from appointments, as well as help these folks navigate the VA healthcare system. Question 7 asks providers what community support resources or programs are available to ag workers returning home from deployment in order to ease that transition to civilian life. The major themes identified were VA services and community support system. Provider responses to this question were very similar to the previous question. Most providers maintained that the community itself was the major resource in place to ease veterans into civilian life. Rural communities are extremely close-knit, and one provider shared, and I quote, "Definitely just the community itself and the fact that they know that people are watching over their family and that helps them transition," end quote. Another provider shared that their community has a volunteer group that specifically helps veterans when they return home, whether that be helping find employment or helping them navigate the healthcare system. Other VA services mentioned were VA clinics or facilities, but most of the time these were out of town and required a decent amount of travel to reach. The final interview question asked providers to share what new ideas or innovations we as public health practitioners should consider when designing healthcare services for veteran ag workers. The major themes identified were educational resources and healthcare accessibility. Educational resources for veterans and their family members to increase overall healthcare awareness as it relates to preventative health, risk factors, military exposure health consequences, and how patients can better communicate their health to their healthcare provider were all responses providers shared. One provider shared, and I quote, "If you don't tell me what's wrong, or if you don't tell me you're out of a medication or otherwise, I simply can't help," end quote. Increasing VA healthcare accessibility by increasing VA partnerships with rural clinics and VA reimbursement perks were responses related to healthcare accessibility. Mental health and telehealth service expansion were also mentioned. Based on these data, questions geared specifically towards the veteran ag worker were formulated as a proposal for AgriSafe Network to consider adding to their existing agricultural health risk assessment e-tool. I will read off the questions here. The first one, what military era did you serve? What country and/or region were you stationed? What branch of military did you serve? What were your military exposures? And they would be given examples via chemical, respiratory, physical, and mental exposures. Are you currently enrolled in the VA system? Do you need help enrolling in the VA system? On average, how far do you need to travel to reach a healthcare facility? Have you experienced any symptoms of post-traumatic stress disorder? And of course, those symptoms would be listed in that assessment. And that is all we have today. Thank you so much for taking the time to listen. Thank you. Funding for this project is provided by the Central States Center for Agricultural Safety